Welcome to Supplements Demystified. In today's video we will be discussing the nutrient carnitine. We will be going over its reported effects on fat loss, athletic performance, brain health and testosterone. We have a lot to cover, so let's get started. Carnitine is a conditionally essential amino acid structure that our bodies naturally produce. Out of all the organs, the liver and kidneys are primarily responsible for producing carnitine by using the amino acids lysine and methionine. Most of the body's carnitine is stored in skeletal muscle, but it is also found in other high-energy demand tissues like the heart, liver, and adrenal glands. Carnitine can be found in a variety of foods, however animal products like dairy, poultry, and red meat are usually the best sources. It should be noted that carnitine content of food can vary wildly, with red meat having the highest concentrations while non-animal sources like whole wheat bread and asparagus having much less. Adults whose diets are rich in animal products can consume on average around 60 to 180 milligrams of carnitine per day, while a vegan diet normally provides only between 10 to 12 milligrams. There are several different forms of carnitine, such as Acetyl-L-Carnitine, L-Carnitine Tartrate and Propionyl-L-Carnitine. We will discuss the benefits and properties of each form, along with their specific application. In this video, unless otherwise stated, carnitine will be used to refer to L-Carnitine Tartrate, and Acetyl-L-Carnitine will be called Alcar. Carnitine plays a critical role in energy production. It transports long-chain fatty acids into the mitochondria so they can be burned to produce energy. At the same time, it also transports out any toxic byproducts and prevents their accumulation inside the cell. Given these key functions, it makes sense that carnitine is concentrated in tissues like skeletal and cardiac muscle that utilize fatty acids. In a study in the Journal of Physiology, participants were given 1.36 grams of carnitine with 80 grams of carbohydrates twice a day, for 12 weeks. Researchers paired carnitine with carbs because insulin is required to transport it into the cells. The low-intensity exercise test at the end of the study showed taking carnitine allowed the participants to increase the use of fat for energy. During the exercise test, the participants burned 6% more energy, which was able to counteract the excess calorie intake from the carbohydrates. The study achieved a 20% increase in muscle carnitine content, and prevented an 18% increase in body fat mass. In another study in the Journal of Food and Chemical Toxicology, mice were given a mixture of red grape extract, soy isoflavone, and carnitine, while being fed a high-fat diet in order to make them gain weight. In comparison to a group of mice fed a placebo, the carnitine group gained substantially less visceral and subcutaneous fat. The placebo group exhibited the beginning stages of non-alcoholic fatty liver disease and atherosclerosis, neither of which were evident in the carnitine group. Carnitine isn't without its controversy. There has been long-standing criticism of studies on carnitine and its effects on weight loss, especially due to possible conflicts of interest. However, in 2020, researchers performed a systematic review and meta-analysis of 37 high-quality randomized controlled clinical trials on carnitine. The results concluded that supplementation provides a modest reducing effect on body weight, BMI, and fat mass, especially among adults with obesity. Carnitine has been studied extensively because it is so important to energy production. Optimal levels of carnitine are crucial for athletes who need to tap into both glycogen and fatty acids for energy during training and competition. A study in the Journal of Physiology gave a supplement of carnitine and carbohydrates to experienced athletes who were training for a triathlon. At various points throughout the study, the subjects performed rigorous tests to measure their performance. After 24 weeks of supplementation, the carnitine group increased performance from baseline by 11% compared to the placebo group, which showed no improvement at all. Participants who took carnitine also rated the rigorous testing and exercise they performed to be easier, while the placebo group had no difference in rating of perceived exertion. The study demonstrated that it takes a long time to raise muscle carnitine levels and reap the benefits of improved energy production. In addition, it was also demonstrated that loading carnitine has to be done via consuming carbohydrates and spiking insulin. A much more recent study from 2021 published in the journal MPDI Nutrients showed that L-Carnitine Tartrate supplementation for just 5 weeks was enough to improve exercise recovery in both men and women. Carnitine was able to improve recovery and fatigue based on reduced muscle damage and soreness after an exercise challenge. Muscle power and strength were also improved in both males and females regardless of age. Researchers note that carnitine had a particularly strong effect on recovery among women. The Journal of Strength and Conditioning Research published a study that examined the effects of carnitine being taken right before training, instead of routinely. Professional soccer players were randomly assigned to either a placebo, or a dose of 3 to 4 grams of carnitine mixed with fruit juice prior to a high-intensity run. The results showed that the players taking carnitine could not only run faster, but also maintain a lower heart rate at certain running speeds. The performance was the same for both the 4 and 3 gram doses. This suggests that a dose of 3 grams is enough to improve performance. Researchers found that carnitine allowed the athletes' aerobic systems to work more effectively, which delayed the time it took to reach the anaerobic threshold. The athletes experienced fatigue later during training, and their performance was enhanced. The rate of perceived exertion was lower in athletes taking carnitine versus those getting a placebo. The study showed that reduced lactate buildup made intense exercise feel easier. Scientists believe that carnitine supplementation allows athletes to limit waste building in the muscle, reduce overall muscle damage, increase fat oxidation and spare glycogen. Carnitine has consistently been shown in clinical studies to restore and improve metabolic health in the brain. Acetyl-L-Carnitine is an acetylated form and is tremendously more bioavailable for nootropic purposes. The major difference between L-Car and carnitine is that L-Car more readily crosses the blood-brain barrier, which is why it tends to be the preferred form for use in brain and nervous system support. The bioavailability of L-Car is thought to be higher than that of L-Carnitine due to better absorption in the small intestine. The Linus Pauling Institute at Oregon State has shown that L-Car can restore mitochondrial health and energy production in the brain. It also helps to restore acetylcholine levels, which are tied to memory and overall brain function. In clinical studies, it has been shown to be beneficial for those suffering from age-related brain diseases such as major depression and Alzheimer's. The Mount Sinai School of Medicine in New York discovered that L-Car could be used to treat Parkinson's disease symptoms. Researchers found it directly affects mitochondrial respiration and assists dopamine metabolism in the brain. The Journal of International Clinical Psychopharmacology published a trial with over 1,000 participants which found that acetyl-L-Carnitine has a significant impact on attention, memory, and other higher-level mental functions. L-Car was shown to be a potent therapeutic for delaying and preventing brain deterioration. A study published in the Journal of Medical Science Monitor looked at the possibility of using carnitine to treat autism spectrum disorders. The test subjects consisted of 30 boys, aged 3 to 10 years old, with a diagnosis of autism. The treatment group received a body weight-dependent dose of carnitine every day for 3 months, while the rest received a placebo. The researchers found that the average score measured on the Childhood Autism Rating Scale dropped by almost 2 points, from 35.7 to 33.8. Testing was able to determine that the increase of carnitine in the bloodstream was directly correlated to improvement of several clinical measurements of autism spectrum disorders. If the study had used L-Car, which is able to readily cross the blood-brain barrier, the results might have been even better. Carnitine has a variety of positive effects on hormonal and reproductive health. It not only supports healthy testosterone levels, but it increases androgen receptors that bind with testosterone. A study in the Journal of Urology compared testosterone replacement injections versus the combination of Propionyl-L-Carnitine and Acetyl-L-Carnitine in the treatment of male aging symptoms. 120 patients were split into 3 treatment groups. The first group was given 160 mg of testosterone each day. The second group was given 2 grams of Propionyl-L-Carnitine plus 2 grams of L-Car daily, and the third group was given a placebo. The results showed the combination of Propionyl-L-Carnitine and L-Car was better than testosterone for erectile dysfunction. There were no side effects associated with an enlarged prostate, and the subjects reported better orgasms, more sexual desire and improved mood. A study from Japan published in the Journal of Rejuvenation Research found evidence for a positive association between serum carnitine and free testosterone levels. 19 male hemodialysis patients underwent a series of blood tests, including the serum levels of free testosterone and carnitine. The results showed that low levels of carnitine were absolutely associated with low free testosterone values. A clinical trial published in the Journal of Current Medical Research and Opinion studied the use of Propionyl-L-Carnitine in combination with Viagra in patients with erectile dysfunction. All patients had been previously treated unsuccessfully with a minimum of 8 administrations of Viagra. When Propionyl-L-Carnitine was added to the treatment, patients showed a marked increase in improved erections and successful intercourse attempts. In a study published in the Journal of Medicine and Science in Sport and Exercise, researchers examined the effects of 3 weeks of carnitine supplementation and post-exercise nutrition on hormone and receptor responses. The results of the study demonstrated a synergistic effect between resistance exercise, post-workout nutrition and supplementing carnitine. Combining all 3 increased androgen receptor content, increased testosterone uptake, and enhanced luteinizing hormone secretion. Now that we've gone over the research and benefits, let's talk about dosing for each specific purpose. If you are only concerned with burning fat and increasing athletic performance, take 2 to 4 grams of L-Carnitine tartrate daily, with a high carbohydrate drink like fruit juice. It can be taken in divided doses, for example 2 grams at breakfast, and 2 grams post-training. For supporting and improving brain health, take anywhere between 500 mg to 1.5 grams of acetyl-L-Carnitine per day. Because L-Car is more bioavailable, you can take less, however for cognitive disorders 1.5 grams is a good starting dose. If you are looking to boost testosterone, fertility and sexual health, Propionyl-L-Carnitine has the most research behind it. You can take 2 to 4 grams a day in divided doses. And here is a bonus tip. If you are looking to supercharge fat loss, combine carnitine with taurine. Together they have a synergistic effect on fat metabolism. While carnitine is very safe and well tolerated, some people experience some gastric discomfort when they begin taking it. So start with a small dose of 500 mg to see how you react. If you have any questions, leave them in the comments below, and remember to like and subscribe for more content. Thank you for watching, and see you next time.